We're actually at the nurses station at the new Advanced Pediatric Care Pavilion at Nicklaus Children's Hospital to show you how they're using the latest technology to help monitor and care for our kids here. With us today is a critical nurse. Jeffrey Yenner is joining us today. Thank you so much for joining us,
You're
Jeffrey.
very welcome.
He's actually going to walk us through some of the monitors and show us the latest technology they have. Something that I found pretty impressive, the telemetry monitoring system. Thank you so much. It allows the kids to actually be free of their hospital rooms. Explain to me how that works.
It sure does, yeah. So, what the beautiful thing about this unit is literally the newest pediatric cardiac ICU in the entire country. So as you said, has all these different modalities to give patients as much freedom as possible while they're here in the hospital. This telemetry device here is something where we can use a special set of what we call EKG leads that go on their chest. This little portable monitor then allows the nurse to slip it into a pocket, and we can take a walk, an entire lap around the unit anywhere, so that we can keep an eye on their vital signs. As you can imagine, in the cardiac ICU, that's a little important.
Extremely, I'm sure.
But at the same time, give them that freedom to walk, not run, but walk at least, and get exercise that's essential to their healing.
I'm sure, in their rooms.
Yes.
They want to get out.
This can definitely be a lifesaver both for the nurse as well as the patient. It's mutually beneficial, yeah.
I was also pretty impressed. I'd never seen one myself, the pneumatic tube system.
Yes.
If you can show me how that works.
Yes, absolutely.
And it also saves a lot of time when it comes to getting results.
You know how nurses love to be efficient, and the pneumatic tube system is something that definitely allows me to not just provide efficient care, but effective care. So what it does is, to all of our important locations, whether it's the laboratory, blood bank, etc., allows us to send message, blood work, whatever it might be, in moments, literally. Load it in, select the station, and just like that, it's on its way.
And it's real different than how you did it before. Before, someone had to physically go to the pharmacy.
Wherever, pharmacy, blood bank, the lab, we had to send someone, which whether it was finding a care assistant who was free, going yourself, but that meant getting coverage for your patient and taking that time from patient care.
Now you can stay with your patient a lot longer.
Yes.
And I understand there's a device that's your favorite if you had to choose one.
Yes.
It's a phone, but not your usual phone.
Exactly. It's an extension of the many computers that you see around here. So I guess you could consider this my work cell phone, because to receive a phone call, I don't need to be standing by a phone. People can reach me directly wherever I might happen to be. I can get new orders from the physician or nurse practitioner that's covering my patient. I can get them directly on my phone. My personal favorite is if I have to step out of my patient's room for whatever reason. Maybe I'm on break, but I want to keep an eye on how my patient is doing since I know them best. I can actually open up an application on this phone that ties into the telemetry monitoring that we talked about before, and I have my patients, not just their vital signs, not just the numbers. I can see the tracings, the waveforms of the electrical activity of their heart, how saturated their blood is with oxygen. Some of these numbers that we focus on as nurses all the time that give us so much information as to how our patients are actually doing. So admittedly, all of the extra alarms and everything that I got with the phone took some getting used to, but all of the kinks that come with using new technology have been pretty well smoothed out, and I've really come to value the fact that I have an extension of multiple devices in my pocket at any time.
That's great. Thank you, Jeffrey.
You're very welcome.